This is the story of the one. As head of maintenance at a concert hall, he knows the show must always go on. That's why he works behind the scenes, ensuring every light is working, the HVAC is humming, and his facility shines. With Grainger's supplies and solutions for every challenge he faces, plus 24/7 customer support, his venue never misses a beat. Call quickgrainger.com or just stop by. Grainger, for the ones who get it done.
Number one for New Country, 99.5 WKDQ. It's the Q Crew Morning Show with Ryan and Leslie. And joining us now, he's a family doctor with his office located at Deaconess Gateway Hospital out in Newburgh. Dr. Andrew Benton is with us. Good morning, doctor.
Morning. Thanks for having me.
Well, thanks for joining us. I imagine you're pretty busy these days, as most medical professionals are, but we wanted to have you on because we've seen our fair share here in the office of some people testing positive for COVID. And when it comes to quarantining and isolation for close contacts, there seems to be a little confusion as to who's eligible for boosters these days. Actually, Leslie, you could probably explain. You're in that situation right now.
Yes, the reason that we wanted to talk to you is because I'm over 50, and so I thought that it was 65 and over for the second booster. I heard rumblings and saw some things, on social media that it wasn't, so then I had to go to my pharmacy and say, hey, is this real? Like, I can get my booster now? And they had to check. So there's a lot of, because it's not put out there as much as it used to be, we knew exactly when, and it was everywhere. What are the guidelines now? Because I know that over 50, I need to have a second booster to be in compliance.
So that's a great question. I get that question in my office all the time from patients. There's a few nuances here, but in general, we're recommending that everybody gets a booster 5 months after you finish your primary series. So for Pfizer and Moderna, that would be your first 2 doses, or for Johnson & Johnson, that would be your first dose. And then people over age 50 or people who have certain health conditions that suppress the immune system, they should actually get a second booster 4 months after their first booster.
So right now, that would be the people, like you said, immunocompromised and people over the age of 50, which would qualify. Leslie, do you have any insight as to when or if they will open that second booster up to people under the age of 50? How does the process work for them to decide who gets it and who doesn't?
Right, so that's another good question. I answer that in my office a lot. So the FDA right now is looking at considering a recommendation for second boosters for people under age 50. We don't have that recommendation right now, although I wouldn't be surprised if that were to come out of it in the coming weeks.
Let's talk about COVID cases here in the tri-state. We do see that they are starting to rise a little bit. I assume, and correct me if I'm wrong, are most of them that you're aware of, is it due to the new Omicron variant? What is it, BA.5, I believe?
Yeah, so pretty much all of the coronavirus cases that we're seeing now are from Omicron, and there are some different subtypes, the BA.4 or the BA.5. Now that's we usually don't nail it down to that specific, on the patient level. So your result isn't going to come back and say BA.4 or BA.5, but almost all the cases we're seeing are Omicron. And some of the differences with Omicron, we think that it's probably more infectious, so more likely to be spread from one person or another compared to past variants. The symptoms seem like they're presenting a little bit differently, and this is more anecdotal that what I'm seeing in my practice. Initially, we were seeing a lot of people presenting with loss of taste or smell, presenting with fever, and I'm seeing less of those symptoms. More of the symptoms that I see in my patients would be like the sore throat, nasal congestion, a dry cough. That seems to be more prevalent now.
And when you say that with this variant, for someone who may not really understand how viruses mutate and work, what exactly, and that this is Omicron compared to what we originally started with, briefly explain why that is.
Let's say if you had a piece of paper and you want to make a copy of it, well, you put it in a copy machine, make a copy of it. Well, every time you make a copy, it might change just a tiny little bit. And when we're talking viral replication, that's going to happen millions of times. So over time, it could change a little bit. And over time, if it changes enough, it's possible that it changes enough that it becomes more transmissible, or it might become resistant to vaccinations or anything else.
I've noticed it seems to be, and you kind of alluded to it there, and correct me if I'm wrong, but it feels like as this virus has mutated, whatever you want to call it, it seems to be, not that it's not any less dangerous, because I know for certain people it still can be very dangerous, but it seems to, the hospitalization rates and the death rates seem to have gone down, and maybe the severity of the virus itself has gone down a little bit. Based on your knowledge of viruses, is it possible that this thing could mutate itself? Maybe not to extinction per se, but because of the mutations, that's the cause of that it's not as strong as it was when it first broke out? Well,
that could be. And so I think there are a number of reasons why we're seeing, although we are seeing an increased number of cases, in general, these people are not filling up the hospitals. They're not passing away like they were at rates earlier in the pandemic. And so that's one of the theories, that perhaps that's because this virus is mutated in a way that maybe it just doesn't do that as much anymore. But I think probably more of that is because most people these days have some amount of protection. And either that's from vaccination, hopefully being boosted, or if not, a previous infection. There's also some treatments that we have available for coronavirus now that weren't available to us even just months ago. We have oral at-home coronavirus treatments that work extremely well to keep people out of the hospital.
Now, I want to ask you, too, as far as like, let's say that someone tests positive, but they test positive through a home test that you can get over the counter at a pharmacy. Yeah. Are you still supposed to let your local health department know so that we can keep track of the numbers in order to help track the virus?
Well, I would recommend that you reach out to your physician about that, and they can put it in their medical record system, and that can get reported that way. There's probably not a whole lot of utility in reaching out to your actual health department. Just to be honest, they probably just don't have the resources to be able to collect all those reports.
But you still want to as far as keeping track of the numbers and being able to study each individual variant and what's going on with it, as long as just contact your medical provider to keep them up to date, right?
Yeah, I think that's one of the take-home points. And the other one here is, like I said, there are at-home oral coronavirus treatments that are available now. And the only way to get those is going to be to speak to a provider about that. I'm a little bit more judicious on who I prescribe that to, but in general, they're reserved for people at a high risk for coronavirus. And your doctor is going to be the best person to determine whether that fits you or not.
That's Dr. Andrew Benton, family doctor, Deaconess Gateway in Newburgh is where you will find him. Dr. Benton, appreciate the time today. Thank you so much.
Sure. Thanks for having me.
This is the story of the one. As head of maintenance at a concert hall, he knows the show must always go on. That's why he works behind the scenes, ensuring every light is working, the HVAC is humming, and his facility shines. With Grainger's supplies and solutions for every challenge he faces, plus 24/7 customer support, his venue never misses a beat. Call quickgrainger.com or just stop by. Grainger, for the ones who get it done.